Alberta Health Services. Healthy Albertans, healthy communities, together.
Thank you, everyone, and good afternoon. I am Gregory Turnbull, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS special public board meeting. Thank you for taking the time to join us. This is a special meeting of the board to consider one motion. To start, in the spirit of promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. We are grateful to those who have come before us and mindful of those who will follow us as we steward and protect these lands. We are participating by teleconference today. When I ask for a vote on the motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take that you are in favor of the motion. If there are none, or a minority, who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Mr. Chair, it's Sherry Fountain. I so move.
Thank you, Sherry. Will someone second the motion?
Mr. Chair, it's Hartley Harris. I second the motion.
Thank you, Hartley. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I asked Brian Vazjo, Chair of the Finance Committee, to present the motion arising from that committee.
Thank you, Mr. Chair. The Finance Committee met on December 22nd, 2021, to consider a recommendation for board approval of Alberta Health Services entering into one or more commitments to procure COVID-19 rapid test kits. Board approval is required in accordance with the Policy 1100, Delegation of Authority and Establishment of Controls or Commitments. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board, 1, approve Alberta Health Services entering into one or more commitments up to an aggregate value of $80 million to procure COVID-19 rapid test kits from vendors that are on the federal government standing offer list for supply of rapid tests, on proposed terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and 2, delegate the authority to the Alberta Health Services President and CEO to execute the documents that give effect to such commitments on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls or commitments policy.
Thank you, Brian. Will someone second the motion?
Mr. Chair, this is Sai Zalki. I second the motion.
Thank you, Sai. Is there any further discussion? Hearing none, is there any opposed or abstentions? The motion is carried. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you for joining us, and please be safe and well.
Together, we do amazing things every day.